Prudent healthcare is really about negotiating a different way of working with the public and with patients, and actually looking at what people want, what they need, what will actually give them a better quality of life. And what we're beginning to find out is those aren't always the same things as the things that we've traditionally done for patients.
The clinicians who were there, and there were doctors and many other clinical groups, and really importantly in our workshop, which is about ENT, we had a very strong presence, for example, from audiology. They learnt that actually it was important to hear what patients had to say about what they expected of our services and what they wanted from our services. We learnt from the data that actually there were considerable opportunities to apply the principles of prudent healthcare to what we were looking at, which was adult hearing loss, tinnitus, and dizziness.
So the first thing was around designing services that provided outcomes that patients valued, outcomes and experience that patients valued. So the first aspect of that is to ask them about the outcomes they'd valued.
So I think it begins to change the power balance in the relationship between frontline clinicians and patients. And I think that will feel a lot better to many of our patients, who will feel much more able to give their views about what they actually want from the NHS.
You couldn't possibly design a prudent programme or a prudent pathway without service users being part of it.
People very often have the expectation that they will go to an expert, and an expert will tell them what's wrong with them and what they're going to do to them. So I think it was a novel experience, but I think when we'd explained the principles and explained we really wanted to work to design services with them, they were really very well engaged.
I think the thing that surprised me perhaps was the scale of work that goes through ENT consultant clinics that could either, for patients either that might not need any treatment or might need a treatment that wasn't best delivered by an ENT surgeon, possibly as much as 20 to 25% in our data collection. We should be spending much more time talking with patients, informing patients, maybe using option grids and other techniques to help them understand what the key issues are in the decision making, and perhaps a bit less time doing some of the treatment.
I think people's first assumption is, perhaps because of the word prudent, that it's about saving money. I think if we think about it as a different way to develop our relationships between the NHS, clinicians and patients and communities, I think that makes it much more interesting to most frontline clinicians. And I would encourage everybody to think about that, is to have different sort of conversations and dialogue with patient groups, with patients individually. And I think that could be very rewarding, and I think it could take us into some interesting places. And I'm sure people will get very enthusiastic about that.